A lot of times you hear if they want to quit, they will quit.
As a clinical social worker and addiction specialist, oftentimes I have to check my bias at the door.
We've often heard terms such as addiction, substance use disorders, the war on drugs. Most recently, we've heard a lot about the term of the opioid epidemic.
I hate to say it, but we kind of treat them differently, like that criminalizing the substance use versus coming with, do they have the knowledge? Do they have the resources? And how can we help them with those things versus saying, if you wanted to, you would stop. They want to stop. We know that they want to stop, but they don't necessarily have the tools to help them stop. And that's one of the things that this program has helped me increase, the tools and the resources that I have available to me to help these families.
At the time, I was working with our recovery treatment court in Mecklenburg County, but we do a lot of clinically driven, evidence-based type practice services for those who have issues or are in recovery from substance misuse.
I registered for the program because at the time I was working with intensive family preservation program, and a lot of the families had substance use. So I wanted to have more education on how to best help those families.
There are a lot of new challenges in the current environment when addressing substance misuse, and having up-to-date treatment options and information can only help those we work with.
Having done the program, it gave me an insight to, number one, change the language that we use when we reference substance use and how we talk with families, and also the policies that we have in place, making sure that the families that I work with do have access to resources that they need.
When we think about the fact that 4 counties in North Carolina are included on the list of top 25 counties in the United States with the highest levels of overdose deaths, that's something that should really be jarring to us in the state of North Carolina. In 2019, a group of faculty in the School of Social Work at North Carolina State University received a grant from the Health Resources and Services Administration that was geared towards helping to curb the opioid epidemic in the state of North Carolina. And when we look at this epidemic, we know that it has wreaked havoc on families and communities across the country. When we look at North Carolina in particular, we know that across rural communities as well as our urban communities, families have really been hit hard by the opioid epidemic.
This day and time, everyone knows of someone, either in their family, that has struggled with substance use.
We partnered with faculty and staff in the Center for Family and Community Engagement to develop the Addiction Specialist Certificate Program.
This program will enhance your knowledge and skill set in this field. The training and information you're exposed to in this program really is invaluable for professional and personal development.
You're going to help so many families. This training is affordable, it's accessible to everyone, there are no degree requirements.
The potential impact of having this kind of training available for paraprofessionals could be the difference between the quality of care.
Our community really has felt the impact of these issues, and we're needing supports, all hands on deck, to think about how we can best combat this opioid epidemic.